Live.
Happy New Year and welcome to the COVID313 Coalition for Families and Students Town Hall. I'm Christine Bell. I am honored to serve as the Executive Director of Urban Neighborhood Initiatives and a very proud member of the COVID313 Coalition for Families and Students. And wow, has 2022 started off with a bang. So we have a really good town hall for you today. We have the health department with us. We have two of our favorite docs on, Dr. Fuller and Dr. Cunningham, to tell us all the things we need to know in this moment, since it feels very much like we are back at March 16th, 2020. And I know that you out there are probably feeling that as much as I am. And some of us really are really like we're back at March 16th of 2020 with our kids home and trying to work and balance our lives while still in the midst of this pandemic. So, but I'm excited to be here with you. We've missed you. And we want to hear from you. So as usual in the town hall, if you have questions or comments for our experts, please put them in the chat. We have Lindsay and Michael and Brooke that are waiting to hear from you. And just to make sure they're on their toes and ready to go, since we might be a little rusty from December, why don't you tell us how you heard about us today, or what you're really excited to hear about on the town hall today. We are translating this town hall into Spanish, and we have ASL interpretation. So Julie, Happy New Year. Glad to have you with us. Good to see you virtually. Can you please let our audience know how they might listen to, or not listen, I'm sorry, how they see the ASL interpretation? Thank you so much. And we have Cristina Guzman with us today, who is going to do our Spanish translation. Cristina, can you please share with our audience how they listen to Spanish interpretation?
Buenas tardes, bienvenidos al COVID charla de 2022. Pueden ustedes tener acceso a la charla en español a través de Facebook de Urban Neighborhood Initiatives de UNI, o en el chat hay un enlace adjunto para que lo puedan acceder. Gracias.
Thank you so much, Cristina. It's so good to see you. Happy New Year. We'd like to thank all of our experts that are here today. And we want to remind them to please speak slowly for our translators. We want to make sure that they want to make sure that they're translating the important information that you are sharing correctly. Also, turn off your cameras when you're not speaking. Make sure that you mute yourself. And our wonderful timekeeper, Terry Whitfield, the best anywhere around, is keeping time, and he will chat you your remaining time. So keep an eye out on your chat. If you are gonna go over your time, myself or Jametta will come onto the screen and gently remind you to wrap up. And speaking of Miss Jametta Lilly, I would like to pass the mic to her. Jametta?
Thank you so much, Christine. And yes, Happy New Year to everyone. Although many of us are trying to figure out, did we really have a holiday break? I imagine many of you, and we certainly know so many of the parents that are out there are feeling all types of stressors. And as we get ready to move into our segments, we want to reinforce how important. Let's start off with dialogue. So be sure that you're putting your questions into the chat, even your comments, as well as if you are watching us on Facebook Live. So we're going to go ahead and get started with our program. We're going to hear, as Christine already noted, we're going to hear from education. We know how critical that is right now with our school closings and some of the questions that are those that are open versus are closed. But central to all of this is Omicron. And to help us keep navigating this and getting the stats and knowing where and what to do, we're always happy to bring back in our Detroit Health Department partners. So we'd like to welcome back Nurse Tanea. Please join us and give us a feel for what the reality is in the city of Detroit right now.
Jametta, before
Yes, I just noticed.
Yep, we have Dr. Vidi with us now, so if you could introduce him, and then I will.
I certainly can. Tanea, as the wonderful shapeshifter that you are, if you could just hang on a little while for us, we are so pleased to be able to have, in this really important time, Dr. Vidi, whom, as many of you already know, is the superintendent for the largest school district in the state of Michigan. And Dr. Vidi, welcome.
Hello, good afternoon. Thank you for having me again.
Right, well, absolutely. And so here we are in a new year. And even though it's a new year, we are still struggling with some extremely complex issues. We know that. We are so happy that you've joined us because like yourself, as a leader, but also as a dad, you know the kind of confusion and frustration that's out there with so many parents. So we are really delighted that you are here to have a conversation with us about the issues, how decisions are being made, what are the resources, and always articulating for us so that we can be partners, particularly parents, but not just parents. If I can add this, many of us are employers and many of us are part of the nonprofit ecosystem in this city. And we want to make sure that we are supporting parents and our schools. So we'd like for you to kind of have that framework too. As you're speaking about the issues that parents need to know, there's a whole other set of people that are here in this struggle, quite frankly, with you to try to love on and move us forward and try to address the issues of concern and a lot of confusion that's there. So happy to have you on board for this conversation. I am going to pass the baton to Christine as part of our moderating. And if we have a few moments at the end, I would love to be able to get in a thought or two about policy and how we can support and move the needle for change and equity as parents and as a community. But Christine, if you could start with some of the concerns that we have been hearing from our parents that we know Dr. Vidi is more than able to give his thoughts and input on.
Sure. So welcome, Dr. Vidi. It's great to have you on today, particularly in this moment. DPS just announced that you all will be at virtual at least until the 24th of this month of January. So can you give us an update on how you're making the choice between virtual and in person, and what information you're using to decide between the 24th, 4th, and the 31st?
Sure. Again, good afternoon, everyone. Thank you for having me, and thank you for just creating this platform to be able to talk to people in multiple communities and really throughout the city. So this is frustrating. So I just want to start there. There's nothing that hurts me more, honestly, personally and professionally, than not seeing students in schools. As a former teacher, principal leader, superintendent, that's what the work is all about, is seeing the beauty of students going to school. And so when we have to make the decision not to go in person, it takes something away from me personally, professionally, and I'll even go spiritually, because I think it's all interconnected. And I advocated for in-person learning at the fall of 2020, and a lot of people disagreed with that, but I knew how important for some families and some students, how important for in-person learning. So every time we make a decision like this, it's heartbreaking, and it's not done easily. But with that said, as we were approaching the return after winter break, the return was Monday, January 3rd. it was very clear based on the city's infection rate, the 7-day infection rate, so the average of 7 days, that we were at an all-time high. We were above 40%. And so just so everyone on the call, that means for those that are testing in the city of Detroit, almost every other person that was testing was positive.
Right.
And so it meant that this new variant, not as severe medically, depending on your health conditions, whether you're vaccinated, et cetera, but much more contagious. And we had a lot of sick people, globally, nationally, statewide, but especially in the city. And we voluntarily allowed employees to start to test the week before the return, just as a courtesy and to start to gauge what our district infection rate looked like. And we were at like 15 to 20% of our employees and even the students that voluntarily tested. So ultimately, the decision was made to suspend in-person learning, one, because of the high infection rate and the likelihood that opening schools would have just spread that. Even though we're masking and testing, it was inevitable. The other factor was that it was going to be very hard to staff schools. And that has nothing to do with vacancies. It all has to do with people being sick or having a quarantine if they came in and other people were sick after they came in. And this is what we're seeing play out in large urban school districts that tried to open. Las Vegas just announced that they're going to shut down. There's multiple large urban school districts throughout the country that initially tried to open and now they're going online. And there are a lot of Metro Detroit school districts that did open that are struggling right now with like half of their teachers out right now because of COVID or quarantining. So big picture, large spread if we opened, and staff shortages and a lot of student absences. So I think ultimately we made a hard but right decision not to open and to move online. We tested all our employees. 1,000 employees and contractors that work in our schools tested positive. So that would have meant depending on if people tested or not, they would have come to work, spread the virus. 15% of our students, about 3% that tested were positive. So hard decision, but I think we made the right decision. We gave out laptops last Thursday, Friday, Monday, and Tuesday. We started online learning last Thursday, had a low attendance rate of about 58%, went up a little bit more on that Friday at 61%. By memory, on Monday, we were at 70%, then 74% Tuesday, and then Wednesday, yesterday, we were at 76%. So we are seeing more families logging in, students logging in, which is exactly what we want to see. Last year during online learning, we averaged anywhere from 70 to 75% of our families or students logging in. So we're about where we were last year. I saw some of the questions. So every family is eligible for a laptop loaner. So about a year ago, beginning last school year, we gave out about 48,000 Connected Futures laptops with internet connection. Many of our families still have that, and that's what they're using. If that was lost or broken, and we gave out laptops last year, about 30,000, and then this year we gave out another 11,000 laptops. So we have very clear inventory about who received a laptop and not. If a family received a laptop and it was lost or broken, and they have to come into the school where their child goes, ask for a laptop, we'll record that, and then district staff will actually deliver the laptop to the home. We have IT hubs running throughout the district. That's 9 through 4 on every day that we have online learning at Renaissance, Western High School, Fisher Upper, and King High School. So 9 to 4, you can come in, get repairs done to laptops, ask any questions, get a new a wire, a plug if it's broken. We can fix the keyboards, etc. Or if you just have general questions, we have a homework hotline that we're running in the afternoon. We also have a mental health hotline that we're running. We're giving lunch and breakfast out at every school. So every school throughout DPSCD is giving out lunch, breakfast and lunch on Mondays and Thursdays. It's grab and go. So it's packaged meal, cooked meals where you pick it up on Monday and Thursdays, anywhere from 9 to 1, and you'll have meals from Monday through Wednesday, and then Thursday over the weekend until the following Monday. That'll continue as long as we're online. So, to answer your first question, we're monitoring the infection rate at the city. So right now, we're slightly down. We're at 33% based on the numbers that we looked at this morning. Optimistically, the latest number was, I think, in the low 20s. So we're looking to get anywhere between 10% and 20% as a 7-day infection rate. And I think at that number, we can come back. Just want to remind everyone, we do test every week. It's a saliva test. It takes a couple seconds. It's not the nasal test. The saliva is only used to test for COVID. We don't use it for DNA runs or any experiments or anything like that. Right now, we have 73% of our students who have submitted a consent form to test. We can't force testing. We have to get the consent from the family because it's saliva. This is the best way to keep your child safe and in school, stop the spread of COVID, and protect our employees and make our employees feel comfortable and safe coming to work as well, considering we have such a low vaccination rate in the city. Fortunately, the state of Michigan and the city's health department has allowed us to have direct access to the vaccine now. So we are going to be able to offer vaccines in schools in DPSCD. We're still working out the details, but we'll start at least one school in every feeder pattern. And when I say feeder pattern, I'm talking about the historical high school. So Northwestern, Central, Western, East English Village, Cody, Henry Ford, there are about 15. So every feeder pattern will have one school at the beginning that has the vaccine. We'll give that out during the day, a little bit after school. And then we hope to expand that throughout the spring and the summer so we can have greater rates of vaccination as we move in the fall. We now have an employee vaccine requirement. Over 80% of our employees are vaccinated. About 90% of our teachers are vaccinated. And we are contemplating a student vaccine mandate for the fall. So in order to possibly go in person in the fall, you would have to be vaccinated. We're still looking through the pros and cons of that, but we know ultimately the best way to keep students in school is a higher vaccination rate, and that protects the students, employees, and families as well. And we'll be providing more information and more panel discussions and just more engagement in educational sessions so families can better understand the benefit of vaccination. I know that was a lot. Tried to run through what I have been talking about, unfortunately, for the last 2 weeks. I think we will be back, I believe, no later than January 31st. I'm not just optimistic. I think by looking at the numbers and just the need to return, I think January 31st gives us enough time to let the spread come down, the infection rate come down, have people test and come back on the 31st. And then we're just going to weather the storm after that because we know children need in-person learning.
So Dr. Vidi, I'm glad you talked about the 31st. I think what we're hearing from parents, young people, I'm a parent, also an employer of parents of DPSCD students. And what we're hearing is this frustration about timing so that parents can actually plan.
Yeah.
And that it feels like they're being told, and from an employer standpoint, I can say it definitely feels, we're adjusting, at the last minute. And so why is there a way that the district could give parents more time so that they can plan long term, right? So if on the 3rd we had said we're not going to be back until the 31st, then you can plan for 3 weeks, as opposed to, I'll speak for myself. I was planning on having one of my staff members back in full capacity I was like, I can make it till the 14th. And then, and then it was like, oh, I can't, we're going to have to make this adjustment.
Yeah.
And I really think about the parents that don't have a flexible, can't actually call their employer and say, hey, I need you to be flexible with me right now. And that they're having to make these real choices about working or not sending their kids to school. So could you talk a little bit about why you made the decision to say the 24th and maybe to the 31st, as opposed to just saying we're going to be virtual until the 31st, plan for the 31st?
Yeah, I think I hear you, and I think your question is a question that a lot of families have and employers have. We said the 24th or the 31st only in the case that the infection rate really goes down rapidly over the next couple of days, throughout the latter part of this week into the weekend, where by midweek next week, if we're down to low 20s, then we could open on the 24th. That's why we tried to give the 2 dates, just not knowing exactly where this variant, how fast will it go down, or will it continue to go up or stabilize? So that's the rationale between the 2 dates, the 24th and the 31st. We want to open. That we have a sense of urgency on that. But as I said earlier, we're trying to balance fear of employees, likelihood of spread, likelihood of staff shortages, which then really waters down the in-person learning experience anyway. If most of our teachers are sick or quarantining, or our custodians are sick, then we can't clean building. It's just, they're all interconnected. So, what we are going to do is, now that we have a sense of how best to test employees before they come back, we have, regular testing now connected to the district. What we'll do a better job of now is, obviously we have midwinter break coming up, and then we have spring break in a couple months. So what we'll say in advance is what we'll likely do is, instead of coming back the first day after midwinter break or spring break, we'll announce early that those will be online learning days, at least like the Monday and Tuesday right after break. That'll give employees time to test if they didn't test, the Friday, Saturday, and Sunday before we return, and we'll announce that earlier. So we are going to learn from this. We continue to learn from this, and we will announce online learning days highly likely right after breaks, in order to reduce the spread and give families enough time to plan out employment and childcare if they have young children. Unless something else happens with these variants and COVID in general, I believe that we'll open January 31st. I would say I'm 90% sure we'll open on the 31st. The only reason it wouldn't happen is variant turns, and I don't think it will, where we're back up to the 30s and 40s, which I don't think we will. Even if we're in the mid 20s, low 20s, we will open on the 31st. Again, the 24th was used as a date only if infection rates dramatically and unexpectedly went down latter part of this weekend, and early next week, which I don't see it happening. But wanted to open up the door because we know students need to get back into school.
So Dr. Vidi, is it safe for parents and employers? And then I think the Jametta referenced the nonprofit organizations that deeply are committed to supporting young people and their families, that we plan till the 31st, and knowing that DPSCD is so eager to get students back into the buildings, that that you will open up after the 24th if you can, but that they should plan until the 31st.
Yeah, I think that's right. I think there is a small chance that we'll open on the 24th. We would tell parents that by Tuesday of next week, and at the latest Monday morning. But that's probably what we're looking at. And then I would say 90% chance that we open on the 31st. I would completely expect to open on the 31st.
Okay, so I have five. The questions are coming in.
Yeah.
So I'm going to stop asking the questions that we developed, and I'm going to start to ask questions that people are asking.
Yeah.
Sure.
So, because I have like the bubbles on my phone. So why are these decisions made last minute when teachers and parents were requesting hybrid models before school began? And I think you talked to a little bit about this, about how important it is for students to be in school, but is there anything else that you want to add about that, Dr. Vidi?
No, I've said this often. I think hybrid is the notion of hybrid is actually over celebrated. Again, remember, hybrid means that part of the week you're in person, part of the week you're online. And so that really doesn't stop spread, or it doesn't necessarily dramatically reduce exposure. If you're coming to school in person, you're coming in school in person, and there is obviously a risk that is entailed with that, whether you're an employee or a student. And just going back to the points that you made, most of our families are not in a situation where they have great flexibility with their work schedules.
Right.
So hybrid actually can become more disruptive than just going in person. The other thing that we learned last year was we kept our schools open as learning centers. And there was a lot of resentment among our employees because teachers were essentially working at home and working remotely, teaching at home. Yet our para-educators, school culture facilitators, attendance aid, well, really just paras, trainable aides were working in person in order to manage the learning center. And there was resentment. There was a feeling that there was, the salaried employees were at home and the hourly employees had to work in person. And there was resentment for that. And I understood it. I think we did it because we had to give our students some level of consistency and access to schools and even food. But we didn't want to replicate that moving forward. So that's why we didn't go hybrid at the beginning of the year. And we're not going to go hybrid unless the only school that's hybrid is CAS. And CAS Tech is hybrid because of the large number of students that attend that school. And from the outside, CAS is a building looks really large. But when you go in classrooms and you look at the square footage, it's actually much smaller than it looks like from the outside. Administration, lots of students, lots of parents felt that coming back last fall, this year, at 100% would have been tremendous spread and challenges at the school. So that's the only reason CAS is hybrid.
CAS is an enormous school, but I hear what you're saying. Like just this year, my dad tells me stories about having to go from class from the first floor to the 9th floor, which was in the old building, obviously. But
right.
It feels like the design is actually very similar to
because the ceilings are so high from the outside.
Yeah,
the building looks enormous, but the classrooms are actually very small.
Yeah.
Mhm. Right.
So we were approved for PEBT. Will we be approved for PEBT again for eligible families due to being back to virtual learning? Do you know the answer to that question, Dr. Vidi?
No, I'm not. Just the terminology. I don't want to say something that I just want to know how the term is being used. That's all.
Yeah, well, you know what? For the person that asked that question, we will look into this and get the information back to you.
Okay.
So if the numbers aren't down by the 31st, will it be online or learning only?
Yeah, I like I said earlier, I'm very confident, and I'm not just confident to give an impression of being confident. I am 90% sure we will be back January 31st. We are one of the only school districts in Michigan right now closed. There are some others, Ecorse, River Rouge, but they have expected return dates of next week by memory. So, we have to be equitable with access to in-person learning at the same time. We have to be cautious because we have low vaccination rates and COVID disproportionately impacted our community. But at the same time, we have to have a sense of urgency of reopening schools. So it's just constantly a balance of being cautious and thoughtful and pragmatic, but also with a sense of urgency of coming back. And I think this delay allowed the city spread to go down, allowed potential spread in the schools to go down. I think we will have waited long enough. It will be about 3 weeks at that point. And so I think that's enough time to come back, even if we're in the 20s as far as an infection rate is concerned.
Great. And just our chat moderators are awesome. They put in the chat a link to the state of Michigan, and it looks like the state of Michigan is reinstating the PEBT. And I think that actually that it has to do with the benefit for food. So if you
Okay, I got it.
If
Yep.
you ask that question, our chat moderators already dropped the link in the chat, so you can take a look at that. And that's good news that Michigan is thinking about reinstating it. What extra measures will DPSCD be taking to ensure that children are safe? And then will you be distributing N95, KN95 masks and other supplies?
Yeah, so we have done everything and then some from a CDC point of view and a requirement point of view. You know, we have been universal masking for vaccinated and unvaccinated employees and students. We test every week. We are the only school district, I believe, in the country that's testing at the rate that we do. So every employee and every student is expected to test once a week at their school, no cost, a quick saliva test. We've invested about $1 million in ventilation systems. We are deep cleaning our buildings. We did have a challenge before, right before Thanksgiving, with a lot of vacancies for custodial staff. But now, since that point, we're only down to about 20 vacancies, and we were as high as 60 before Thanksgiving. So we've been working hard to get fully staffed in that area. We have a separate team that visits all schools on about a weekly basis to make sure that we're compliant with wearing a mask, 3 feet of social distancing when possible, deep cleaning classrooms. So we will continue to provide PPE. We do have the 95 masks available for employees and students if they want them. That will be the case when we come back in January. It was even the case before the latest variant. But if you do take a 95 mask at your school, you need to keep it for a week. The recommended usage is a week, and we just don't have the funds and the amount to give out the same way we do the cloth mask or the surgeon mask. So yes, you can get a 95 mask at the school when you come back January 31st at the latest, but you need to keep it for a week, and then you can pick up another one.
So Dr. Vidi, I'm going to ask you this question, but I'm also going to ask that Dr. Fuller and Dr. Cunningham listen to this question because I think they will and potentially give a response because I think they might be helpful in answering it. But it says, with Omicron being much more contagious, how will schools ensure our children do not get sick and bring it home? Families have vulnerable family members at home, babies, elderly, and high-risk individuals. You talked about the masking. You talked about the cleaning and the testing. Is there anything else that you could possibly be doing to ensure that people don't bring the virus home?
Yeah, I mean, I'll reiterate testing. I mean, testing doesn't prevent COVID, it just identifies it, so then you can move to quarantining. But I'll just reiterate vaccine. Mm-hmm. Unfortunately, this vaccine is the most politicized vaccine in modern history. And I completely understand the hesitancy and the skepticism to a certain extent regarding the vaccine, but data is data and statistics are statistics. It is clear that if you're vaccinated, you're not only less likely to get COVID or even the variant versus those that are not vaccinated. It doesn't mean that it's 100% you won't get the variant or COVID, but less likely. But most importantly, it can save your life and it can prevent you from going to the hospital. And the numbers are clear globally, nationally in the state of Michigan, that's the case. So that's why, DPSCD is going to promote the vaccine and create greater access to the vaccine, because ultimately I think it's the best way to protect yourself, your children, your family, and the greater public. I wish the city was talking more about this, but it's not happening, and so DPSCD is going to step in because our children's vaccination rates in the city are at 10% or lower the last time I checked, and our city rates are much lower than other large urban cities throughout the country. So we got a lot of work to do, and DPSCD is willing to step in. But please do your homework and talk to a doctor. Don't just read what you see on the internet, on social media, your friends, even your family about the vaccine. Talk to an actual doctor. And I think they can lead you in the right direction regarding the vaccine.
So Jametta has put a couple of questions in the chat that that I'm gonna go ahead and let her answer. And I know Dr. Vidi, you have to hop off here. I just want to reiterate, my dad tested positive in the last week, and he has 3 underlying conditions, and I can't even tell you how grateful I was that he was vaccinated, because if his risk and the likelihood of him dying from getting COVID is very high, and he exposed all of us, and none of us got it, and we're all vaccinated except for my youngest daughter, who's 3 and can't get vaccinated. So I know it's different in different populations, but the statistics, but I just want to reiterate, I had the gratitude that I have runs very deep, because it was really scary last week. So
and I'll just say as well, because some people email me this and ask me this as I promote the vaccine. I had COVID at over winter break last year, before the variant. And I was okay. I'm in relatively good health. Entire family mostly had COVID about a year ago before the vaccine was available. I still got vaccinated. And so did my immediate family and my extended family. And that was not an easy task, even in my extended family. So I'm not advocating for something that I'm not doing myself.
Yes. So Jametta, if you want to ask the last question, and then we've got to move on to our doctors. So thank you so much, Dr. Vidi, for answering our questions.
I first got to just let you know how much we appreciate your candor. And you even taking it a step further to talk about how this affects you emotionally, your own mental health, and your own philosophy and spirituality around us loving out and supporting kids. I can't tell you how much it's important for all of us in this time to talk about that. So that leads me to talk about those populations of children who are even more vulnerable. You mentioned that there's a mental health hotline, but we know that we have a disproportionate number of kids in the district who have special needs, but we also have a much larger number, probably particularly of our little ones, who never even had their diagnosis. So, but what and not getting that help, or not getting mental health therapeutic interventions on a regular basis, can actually be devastating over a 2 or 3 week period if there's a gap. What else is the district doing right now that is helping those families other than a hotline, those who have significant developmental disabilities and or are part of the mental health supports that you've been able to put in place?
Yeah, well, fortunately, with COVID relief funding this year and next year, we've dramatically increased mental health support at schools, and that's one-on-one or small group type of therapy for students. Those students with IEPs and those students that do not have it, and that's across the district. Our challenge with providing that type of resource is just the consent of families, because you start to talk about some very sensitive issues. Unless the student is 18 or older, we have to have consent from the families, and we do struggle to do that. And it's understandable, because a lot of the issues that students are facing and going to deal with are probably linked to the home, and it can be difficult. But I am proud that and excited that we've been able to extend it. Now, we've been able to extend that this year and next through contracted services, not full-time employment, because the dollars we're using are one time. Once we use it, they're gone. But that is available to all families. That's available in person, but it's also available online. So all of our social workers are still working, through their individual schools. Our guidance counselors, those mental health supports can be provided online as well. So just raise your hand and say you need help. So email your principal directly. You can even email me directly, and I'll figure out how to get the resources to you or to your family, or at the minimum use the hotline. When I get off, I'll use the chat if I can, and I'll type in the number. I don't know it by heart, but I'll put it in the chat so everyone can see it.
Great. And so families and partners, we need to support this issue probably more than we were even aware of, because I'm so glad that you said we already know there's a stigma relationship to mental health and people's perceptions about who should get support. You also said that only 70% of families are consenting for their children to be tested. So I want to just kind of say a positive challenge so that the schools can't do this work by yourself. So all of us that are in this space, to my colleagues, to all of us who work with parents and families, we've got to also figure out a way, we've got to be more involved in addressing these issues, because Dr. Vidi, I would assume that there's going to be real consequences at some point if you've got kids who are parents are refusing for their children to be tested, and you're seeing upticks in positivity rates. So is there a message that you'd like to send to those parents right now?
Yeah, so we were at about 60% by memory before winter break, and we have improved by about 10 percentage points, 13 percentage points since break. I think our teachers have done a great job talking directly to students and even families who are in the background as students learn to increase that rate. I don't believe that this is about objection to testing. I really think it's just about parents, having the time and understanding that they have to consent. Every student in the district has their own district email. So families, talk to your student about that. You go through your student's email, and I send a lot of emails now through that about information, because we're not doing the backpack letter home because we're not necessarily in school. So in your child's email, there's a link in one of the emails that you just click on and fill it out. It's real easy. You can also do the hard copy and submit it, or you can scan it as well. And we've sent this out a number of times through district email, robocall, and text. But please fill out that consent. There's only a small number of students based on their medical condition that can't produce saliva, or cognitively, struggle with the concept of the saliva test. But those are a small number of students, and we're working through another option for those students. But please get those consent forms in. We are considering by January 31st, and we'll allow some time to make sure we fully understand that you're objecting as a family. But as we move into beginning of February, mid-February, we are considering those students that object, or families who object would have to go virtual. So just, you say consequence is a health consequence, but ultimately we have to keep our children in school, and we have to minimize the spread in our schools. And the best way to do that is through testing until our vaccination rates improve.
So Dr. Vidi, thank you. I'm getting multiple. We've got to wrap it up. So Thank you so much. Parents, check out your emails, look at your text messages. You're getting this information in the robocall, and we are going to move on to our doctors. Thank you so much, Dr. Vidi. And Jametta, I think you are up for interviewing Dr. Fuller. And so Dr. Fuller, if you could come on to screen, and Jametta, I will let you take it away.
Certainly. Dr. Fuller, as always, thank you so much for being with us. I particularly had the opportunity to hear you speak to providers last Friday, and now we're back in this space to talk to families and everyday folks that are in our community, as well as professionals in other areas. So if you would, I think one of the first things we want to ask, can you help those who are not clear? What is significantly different about Omicron versus what we've heard before? And why is there all this discussion now about the issues around safety and spread? If you could break that down for us.
Sure. So it's good to see you all again. Happy New Year. Omicron is a variant of COVID-19 that has over 50 changes in it from the viruses that were circulating before. Delta had, I think, around 10 or so changes. Think about just if something changes its shape or changes a small bit of it, those changes are able to survive because they make the virus more competitive. And these viruses, as all viruses and all life have to do, they have to reproduce or otherwise they become extinct. So every living organism seeks to remain alive. Omicron has risen to the top because the changes that happen to occur randomly in its genetic material, RNA, made it much more easy to transmit. The laboratory studies are showing that it is much more able to replicate in the cells of the nose and throat, but less well able to replicate in the cells of the lungs, which is good because that means it seems to not be as virulent. It doesn't cause as severe disease. On the other hand, because it spreads so much easier, some say 17 times more quickly than Delta, that means so many more people are getting infected. So people who are unvaccinated are highly, highly vulnerable to Omicron. It's sort of, as someone said, it's turbocharging through the world, really. And it is highly, highly, highly contagious, which is why every family knows someone. Even our family over the holiday, our son, we were getting together in South Carolina at Hilton Head, and he went to a business dinner and ended up on Tuesday not feeling well. He drove with his dad from Atlanta to Hilton Head for 5 hours in a car, both were masked, and the next morning he tested positive. Fortunately, we knew what to do. We could isolate him, and as Dr. Vidi said, nobody else in the family ended up being positive, but that's just what Omicron does. And I actually have a visual here, if I could show that.
Oh, that'd be great.
I think I have, I do have screen share. Okay, can you see this? This is just an example of what Omicron is doing in the USA. So this is looking at the new reported cases since the start back in February 2020. And this is when we first shut down, remember? This is last winter about this time in January. The peak was around 300 cases per day. This is January of 2021, right? But look at what, and this was back in the fall, back in September. Look at what Omicron has done. I mean, that is just unheard of, right? 738 cases reported in one day, which means there are probably tons more that are just not reported. So this is a different beast. It's a different virus variant that has essentially turbocharged itself to be able to do what viruses need to do to reproduce itself. And that's why it's so hard. The good news, however, is that the hospitalizations are not as high and the deaths certainly are not as high. I think there's another graph that shows this very well. These are just simple graphs that show where we are. The Midwest is in the green. Remember, Michigan was really early on back in November, very much affected by Delta and Omicron. And now we are coming down, but other places, even though it doesn't seem like we're coming down, we're not in the peak of this infection. And so what do I mean by that? Here are some pictures from other places where you began to see this high curve going up, but now we're seeming to come to a place where it isn't going up quite so straight. So I hope that that's saying that particularly in some places where it started early, Omicron may be wearing itself to the point that it goes up very high, but it doesn't stay there, fortunately, and it comes down. And then the other thing I want to point out is that what happens, what we're very, very grateful for, and this is something that I want you to be sure to get, is that the cases shown here in the US, again, we're at January 12th, and that's that very high, steep curve. But look at the hospitalizations. They don't follow that. With Delta, the hospitalizations and the deaths went up at the same rate, but not with Omicron. So what we need to do is try to stay away from this. And if we get it, we need to hunker down, stay isolated, make sure we don't give it to someone else, and do those things for the short amount of time. In South Africa and other places, it went up fast, but once it got there, it came down equally as fast. And I believe that's what Dr. Vidi and the Detroit public school system is counting on. We're trying to reopen schools later this month. So we're in the midst of the storm, but it isn't going to last forever.
Yeah, absolutely. And thank you for making it clear that that we are in a storm, but there's things that we can do. Could you share a little bit about the issues of severity? Because we're hearing some people say, oh, it didn't bother me at all. But then we also are hearing more people, because it's affecting more people, literally being knocked off their feet, not being able to go to work, not quite a hospitalization, but saying, I feel like I'm have to do that. Could you give us some idea about the balance of severity and maybe percentages as you understand that?
Sure. So there's this misconception that people should not take Omicron seriously. There are folks that say, well, maybe I'm going to get infected. Let me just go ahead and get infected now. That is not a good idea for several reasons. You never know how this virus is going to work in an individual. The best thing you can do is be vaccinated and fully boosted, which means that you have gotten a booster, and people now down to age 12, even children 12 to 17 can get a boost. So I cannot overemphasize how important it is to be fully vaccinated and have a boost. And what we know is that Omicron is also less affected by the immune system. So some of those changes that I mentioned help it to evade the immune system better than Delta. And so when you get boosted, you now can move that protection back up a little bit. So it's really important. People who are fully boosted may be asymptomatic, or they may get a very sore throat and, feel bad and some congestion and some fever, but it's not enough for most people to send them to the ER or to the emergency room. People who are unvaccinated, however, or who have underlying conditions are ending up in the hospitals, which is why our hospitals are overwhelmed and understaffed. Even our healthcare workers now are out because they're getting sick as well. And you can't work if you're not feeling well. So that's why the CDC changed the guidelines from if you're asymptomatic, stay home for 5 days, isolate for 5 days. And then if you have no symptoms, you can mask for the next 5 days. If you have symptoms, however, you need to stay away from people. You need to be isolated until those symptoms go away, and then wear a mask 5 days after that to be sure you're not spreading it to someone. And that brings up the issue of mask. With Omicron, it's really important to wear a mask, a good quality mask, because again, I'm going to show you a chart here that tells the time it takes. Let's see if I can make this a little bit bigger. Yes. This was done before Omicron. These are numbers from a group that does environmental studies. And so this is looking at the time it takes for virus, not Omicron, not the supercharged one, to spread if neither the infected person nor the uninfected person are wearing a mask. So 15 to 30 minutes in the presence of someone will get you infected. And that's for the whole day. It could be 5 minutes, 5 minutes, 5 minutes, which is why, unfortunately, closing schools is really a wise thing to do when the testing levels are at 40%. That's really the only choice I believe they had. However, if you wear a cloth mask and you want to be sure it's a multi-layered cloth mask, the gaiters are not very good because the air goes right through them. You can spread that out a little bit. The best thing, however, are the surgical masks worn by both people, which you can be in each other's presence. If one of them is infected and the other is not, but both of them are wearing a mask, you see it would take a whole hour or more for any virus to get through those masks. And if you're doing the N95 or the KN95s, which is what my husband and son had when they were riding from Atlanta to Hilton Head in a car for 5 hours, it takes a long time for anything to happen, or essentially it doesn't happen. So the quality of the mask and keeping it on when you're in the presence of other people is so important. If you're using a cloth mask, make sure that it's a multi-layered cloth mask. It's a good idea also to put a surgical mask underneath a cloth mask, because that preserves the surgical mask a little bit longer and allows you to use the outside cloth mask so you can wash that more easily and you get more protection from both of them rather than just one. So Omicron is very tenacious. For unvaccinated people, Jametta, it puts them in the hospital. And if we look now, 98% of the people in the hospitals have Omicron, and still a great percentage of those are unvaccinated. We also know that children under 5, as I think someone said earlier, cannot get vaccinated. So all of us have to protect those people who are vulnerable for whatever reasons, particularly our younger children, because they don't have any choice. The sooner we can get these levels down, the safer everyone is.
So, Dr. Fuller, we have 2 questions, and then I'd love for Tanea from the health department to come on just because we're running out of time. But you said, one of the questions is, how long are people contagious for? You talked a little bit about that, but could you just sum it up? How long are people contagious for?
So the answer to that is it really depends on how much virus you get exposed to and how much you're making. So that can vary with people, but in general, anywhere from 2 days post-exposure with a peak at around 4, 5, 6 days after the exposures when people are most contagious, they're putting out most virus. That's when they need to be isolated. And that means in a room someplace away from other people. And also that's when you're likely to see symptoms, but a person does not have to have symptoms to be contagious. That's the other piece. There are a lot of asymptomatic people that are putting virus out, which is why this 40% positive cases that we see in the school system is happening. And so once the symptoms go away, if you have them, or somewhere around the 5th or 6th or 7th day, people typically are producing less virus. That still means you can transmit virus because there's still some virus there. Usually the home test will also show up a positive if they're going to be positive on the 4th or 5th day. So if you test too early, you'll miss it, right, with the home test. 4 or 5 or 6 days is when people are most likely to show positive, even though they've probably been putting out virus since the 2nd or 3rd day. So most contagious, I hope I'm answering your question, somewhere between the 3rd and the 6th day. And after that, though, still mask so that if you are putting out virus, you're not getting other people infected, because then the cycle just keeps going.
So this leads into the last question. If someone is positive and returns to work after 5 days of isolation, will they bring the virus to the workplace and spread it? And so I think this is really getting at this change from the 5 day to 10-day guidelines. And I heard you say, if you have symptoms, you shouldn't be going back around people because you're contagious. But could you answer that question?
Let's be clear. The CDC guidelines were changed, but many people are running past what they were changed to. They are 5 days isolation if you test positive and have no symptoms, plus then 5 days of masking of KN95 or double masking with a surgical and a cloth mask for an additional 5 days. So if you go back to work, that means you must be masked the whole time. And that was done such that we can have folks who are feeling better or who maybe didn't feel bad because they were asymptomatic in the first place, but tested positive, to now be able to put on a mask, keep any virus they're making inside that mask, and help with the personnel shortage that we have due to the high levels of COVID. The other rule is if you are showing symptoms, if you have a sore throat, a runny nose, a headache, or fever, or whatever, then you stay home as long as you have those symptoms, and you continue to isolate until those symptoms are completely gone. Then you add the 5 days of masking after that. So if it takes me 8 days before my headache and my symptoms are gone, then I'm still going to add 5 days of masking to that time before I am likely not able to spread virus to someone else. So what we keep hearing, people hear 5 days isolation and you can go back to work. Well, that's only if you're asymptomatic, and also requires that you are very diligent about wearing a mask to make sure that no virus you're making is being given to other people, because that just keeps the cycle going on and on and on. And we need to break the cycle of virus
Yep.
infection.
Thank you so much, Dr. Fuller.
And we can do it. We just have
yeah.
to all do it at the same time.
Yeah, right.
And have people like you make that clarification, because you're the first one I've heard that's added the clarity about why it's so important and what's the additional 5 days of staying masked up. Thank you.
Very critical.
Mm-hmm.
Thank you so much, Dr. Fuller. And we are a little bit over time, but I do want Tanea, if you could come on. And we've heard the numbers. We hear where Detroit is. I think just following up on what Dr. Fuller said, and so this is the one question I'm going to ask, and thank you so much for being on here for an hour, and that we're giving you a very short amount of time under the circumstances. Thank you, Dr. Fuller. We are so very grateful for you. You bring so much clarity when you talk with us, and it has been personally really helpful to my family, but also as I make decisions in our organization so that we can keep everybody healthy and safe while still moving really important work forward. So thank you so much for being here. So Tanea, where can people find masks?
So
and is the health department giving them out?
Yes. So thank you for the question. The Detroit Health Department is giving it out. All you need to do is call 313-876-4000. There are option number 1 and then option number 2. There you can order them through the call center. You can always email us, whether it's school, public, people, businesses, anyone can order through email, dhdOutbreak@detroitmich.gov. And we do, I believe I sent over a graphics as of what Dr. Fuller is mentioning, because it is a lot of information. So the slide, you guys have a presentation and with that graphic that is very helpful. And please share that with the public as far as quarantining and isolation.
And then the last thing that Jametta would like to know, what's the max number of masks an organization can order at one time?
That's a good question. I personally do not know. I do know that we have ordered this week some from Michigan, the state of Michigan. So we're waiting on shipments right now. So I don't know how much we have in stock, but we did order some. You can always, anyone else can always go on the michigan.gov website and order from there also.
So the last question is, I know that you all have made some changes with testing and in terms of accessibility, testing and vaccination. Can you quickly go over that? And then we're going to move to close. And I think, Jametta, you are closing for us, but go ahead, Tanea.
Okay, awesome. I'm just going to show this slide right here that will show for children for vaccinations. City of Detroit, children 5 to 11 can go to the Northwest Activity Center on 18100 Myers Road, Monday through Friday, 9 a.m. to 7 p.m., Saturdays, 9 a.m. to 1 p.m. The Detroit Health Department on 100 Mack Avenue, hours 4 p.m. to 8 p.m. We are working closely with Detroit Public Schools, Escuela Academy, and other schools to be present and to train how to give vaccinations. We are offering boosters for children 12 and up. And testing. We have two testing sites for the city of Detroit. The Joseph Walker Williams Center at 8431 Rosa Parks. And the TCF or Huntington Place, we are also offering appointed. You do have to make an appointment. Call 313-230-0505 for test.
So I just want to say I got my booster last Tuesday, and I think it was really easy. You can just walk in.
You can
So,
walk in,
yep.
you can, for boosters, just testing needs to have an appointment. Anywhere else, we have you can always call us at 230-0505 to find a location near you.
Right.
We have so many locations.
Yes, and it was really easy. And when my dad tested positive, I said, I need to go get my well, I didn't know if he had tested positive, and I said, I need to go get my booster. And so I decided, and I had my booster in 2 hours. So so thank you for making it easier, the accessibility easier by allowing vaccines to be by walk-in when you get an inclination that today is the day for the booster or for the
Also
vaccine.
drive-in.
So
you can drive up to TCF. We do have drive-up sites at Triumph Church, at other churches.
Great. Well, I'm going to pass this to Jametta. I'm sure we're going to ask you to be back here next week because we are still in the throes of COVID. And so Jametta, take us home.
Yeah, I certainly will. And Tanea, you should know, Detroit Health Department, we're all in this together, and we're stuck at the hips to do this work. And we feel the same way about so many of our guests. But we also want to provide you with important resources. Deja, I believe you might have a couple of these on slides, but we want to let you know there are some awesome activities that are coming up, because as we all should know, is that this coming Monday, the 17th, is the opportunity for us to hit pause as a nation, to think deeply and take action around social justice in honor not only of Martin Luther King, but the legacy that he and so many of us have continued to try to work on. The Michigan Education Justice Coalition is doing a Healthy and Healing School launch. 4824, our phenomenal partner, is making that happen. The link is in the chat, I believe. We want to encourage you to please be engaged in that, a day of action. Also, UNI, our United Neighborhoods Initiative, is doing a mobile unit in partnership with Wayne Health. So remember, if you need vaccines, you can call the Department of Health, but also there are units that are available in your community. So UNI is doing one that's coming up tomorrow, January the 14th, from 1 to 5 p.m. Not only can you come and get tested and get vaccines, but so important, you could also get other health screening, because we want you to be safe and healthy, both with COVID and for your ongoing health and wellness.
And if you are Spanish speaking, we have Spanish speaking. Sorry, it's bilingual. So there are folks, if you're Spanish speaking, where you can ask your questions and so on and so forth in the language that you're most comfortable with. So come and see it. That's
incredibly important. And just the other piece to add to that, there are no concerns about your paperwork. If you are a human being and you have this medical need, please show up. You can show up tomorrow at UNI and to our Latino sisters and brothers who are, non-English speaking or struggling with that. Some, as Christine said, there will be interpretive services there for you. Also, Detroit Parent Network is partnering with Better Men Outreach. We're real excited about this new partnership. And we are doing another Healthy Family Cafe. And in this cafe, we're talking about choices not only relevant to COVID, but the other critical concerns about health. And we want you to know that you can go to our Facebook page. That Healthy Family Cafe is going to be Tuesday, January the 18th from 5 to 7:30 p.m. Check out Detroit Parent Network's Facebook page and you can register and get the information there. But you don't have to register to come. Parents, little people, adults, you are absolutely welcome. And by the way, too, check out some of our previous Healthy Family Cafes, of which help that are starring, if you will, Nurse Tanea and others. Something else is very important happening, and that is the Kellogg Foundation has been working very hard to have what's called a Day of Racial Healing. Racial healing activities are happening all across the nation. And we want you to particularly zoom in on that Detroit Public TV. On their Facebook page is going to be recognizing and helping to move that forward. That is Tuesday, January the 18th right behind Martin Luther King Day, a day focused on racial healing, and not just talk, but the work that may be involved. And thanks to the DPTV for providing that for us. Wayne State University is doing their annual recognition of Martin Luther King Day, and that's going to be this Friday from 10 to 12 p.m. Again, that's Wayne State University, and what they do every year is a recognition of providing awards that are built upon the legacy of Dr. Arthur Johnson, who was a significant figure in the city of Detroit around community service. And I am pinching myself. I am still utterly amazed and humbled. I've been nominated as one of the recipients of the individual award for the Arthur Johnson Community Leadership Award. No one could have told me this was coming, but I'm so blessed. I'm so humbled. And please join us because we have some great speakers. You can get more information about that on our Facebook page at DPN. Again, that's tomorrow from 10 to 12. All right, families, resources. Get those masks. You can get those masks by calling the 876-4000. Make sure that you go to option 1, then go to option 2 with the Detroit Health Department. You can also go to the Wayne Mobile Health Unit. Remember, that's happening tomorrow at UNI from 1 to 5 p.m. and you can get the appropriate types of masks. Remember, we're advocating. Omicron is different. This is not business as usual. We need you to be fully masked up in the most protection that you and your children need. Also, that you can go to the mobile testing sites that you'll see at the state of Michigan by the michigan.gov website. Last but not least, again, just emphasizing how much we hope that you are getting out to the mobile sites. There is going to be another Wayne Health mobile site no, actually, it's not going to be another one. This is the same information. So get over to 8300 Longworth. Between 1 to 5. Make sure that if you have any kind of needs, not only for vaccines as well as testing, but for other critical health screening, and know that you will have a bilingual staff there to provide information and support to you. And with that, families, I believe that this is the return of COVID313 Community Coalition, and we are overjoyed and steady and fierce in our commitment to continue to inform and keep you powerful. So in our commitment, we are collaborative. So in the spirit of collaboration, I'd love to ask all of our team members and our guests that are still with us, if you would come on screen. Because we are only able to do this work and we support each other as a team. And by the way, did any of us think that we would be doing this in January of 2022? When we started the second week of March in 2020? I know we're all going, duh. So community, we're just letting you know that we are right here with you. We know how tough and awesome this is, but we know that Detroiters and our larger community, we're made of strong stuff, right? So with that, stay strong, stay powerful, be blessed, and keep each other